everyone. The Indian Medical Association of Queensland has been running a public health lecture series since March 2020. Our members, who are doctors of Indian origin and practice in this wonderful state of Queensland, they volunteered their valuable time and expertise in this endeavour. The advice given by any doctor is of general nature and meant for information and education only. Please note, this is no substitute for your own healthcare professional, and everyone is advised to consult with their own treating physician for ongoing health issues. I will now ask the Secretary-General of IMAQ Queensland, Dr. Cyril Fernandez, to introduce to you our guest speaker of this month.
Welcome to another episode of Aap Ki Sehat, or Your Health, conducted by the Doctors of Indian Medical Association of Queensland. Today we welcome Dr. Vikas Moudgil, who's a leading psychiatrist working in Brisbane at the Royal Brisbane and Women's Hospital.
Thank you.
Welcome, Vikas. Dr. Moudgil, who is an eminent psychiatrist at the Royal Brisbane Hospital, as Dr. Abba was saying, clinical director, a lot of experience in psychiatry in India and Australia. So, Vikas, let me ask you a first question. Please tell us, viewers, about your journey as a doctor, your educational background, your professional achievements and journey, please. Thank you.
Well, thank you. First of all, I'm very humbled and thankful to IMA for giving me this opportunity. Thank you for the nice introduction. I am from India, as we know. I did my primary and secondary education from Chandigarh. Chandigarh is the capital city of Punjab and Haryana in northern part of India. I did my medical degree from Government Medical College, Amritsar. The old name of that was Glancy Medical College, Lahore. So you can imagine the old state of building where I got my education. I got my MBBS, did my internship from Chandigarh. And then in 1996, after working for a couple of years as a house officer, I moved to New Zealand, Auckland in 1996. Where my journey was indeed very tough, I'll be honest with you. Still thinking about it gives me goosebumps. Trying to do odd jobs to get into medical degree, giving the exams again. I went for strawberry picking, into some office cleanings. All of those things you have to do when you move to a new country, and I say I'm not the only one. Lots of people have done those jobs to find a base. But after going through the registration exam, then I got into psychiatry training in Auckland, in New Zealand, and I completed my fellowship in 2004. So, and after that, I moved to Brisbane in 2008, and I've been working in Royal Brisbane and Women's Hospital since that time. I didn't go to any other city, but stayed in Brisbane. So my current role is, as I mentioned, as a psychiatrist. Not a psychologist. Lots of people think that I'm a psychologist. Yes. I'm a medical doctor with psychiatrist, psychology experience. Plus, I'm the director of the biggest mental health services in Queensland, Royal Brisbane. In addition, I'm also the administrator of the Mental Health Act, which means for people who lose their capacity and are putting themselves or others at risk, I'm also responsible for making sure they get the treatment, which may be against their wish, but the use of Mental Health Act, I have to make sure it's used judicially and carefully. So that's my role. Plus, I've also got the secretary job of Queensland branch of Royal Australian College of Psychiatrists, where my job is to make sure that government gets proper advice on health decisions and psychiatry intervention. Psychiatry underpinning of all the policies, health policies. In addition, I'm also the Queensland representative of Psychiatry Family Violence Network. And this is about giving our registrars, that means our training doctors who are trying to be psychiatrists, they get adequate knowledge about how to recognize, how to assess and provide intervention for family violence. And I've been pretty vocal about how cultural issues also contribute to family violence in our society. And last but not least, being the member of Australian Medical Association and Indian Medical Association, where I have found my identity and roots and been able to mingle with people from other professional backgrounds and contribute toward the society. So thank you very much. That's my brief background.
That's quite a nice, interesting introduction about you, Dr. Vikas Moudgil.
Thank you.
You have highlighted the tough journey of a doctor. And rightly said, in mental health, it's like a step ladder pattern. We have social workers, we have clinical psychologists in the allied health side, we have GPs like me and Dr. Abad Shikarsal and others who are cornerstone of primary care, still dealing with mental health. But you are still right, as especially on top of all of us, as a specialist psychiatrist, I have seen you in different community health talks on domestic violence and other issues and related to the Indian community flag ceremony and other things, So, look, can you give us and listeners there's some scenarios in psychiatry, like what all medical conditions you encounter in your area of field?
Oh, that's a good question. What I like to explain this in terms of is a spectrum, because on one end of the spectrum you got mental health, which we all need. The other spectrum is mental illness. We all have our own ways of dealing with the pressure, stress in our life. So I can start by talking about anxiety, which we do need anxiety in terms of fight and flight. It means either to prepare for the stress or to run away from it. And we all need that because we need to be working towards solving problems. But if that level of stress, which is good for our growth, which we need that, not every stress is illness, but if it becomes quite excessive and longer in duration and it affects your mental well-being, physical well-being, sexual, social life, interpersonal life, and you can't perform or study, then it becomes an illness. Then it becomes, the anxiety has got different aspects. Then people start to have either panic attacks or phobias. It means they don't like going to places where their anxiety panic attacks may get triggered. Then people have got generalized anxiety disorder. It means they worry about so many things. They can't control it. It's very interesting to see people say that, I know I shouldn't be worrying, but I can't stop it. Plus people have got some traumatic background or abuse they may have witnessed, and that keeps on repeating themselves in their life. And especially very crucial and important to recognize in our migrant population, because we have seen tough times in our own countries, and when we see tough times in trying to settle in this new countries, we have our previous traumas or other anxieties start to get triggered or exaggerated. So we do need to address anxiety related issues. But if they are not addressed properly, then what can happen is it can lead to either depression, which has got other aspects of which people
suicidal thinking,
people sometimes
dangerous.
lose touch of reality, and people can't find enjoyment. They start to get very angry, upset, they lose relationships, and then people end up finding drugs and alcohol to deal with their issues. And what that leads to separately is the substance and drugs and alcohol issues. So it is very complex network of how illnesses get evolved. On top of that, what we also tend to see is people may have genetic vulnerabilities. If we are predisposed, then we may end up having bipolar illness or schizophrenia type illness. So we all have to sort of look into this bigger picture of, if we don't look after our health and don't recognize our stress and how we deal with it and don't manage our life properly, some of our previous illnesses can get triggered and our other illnesses can develop. So two things can occur. And so this is the way I explain mental illnesses in terms of mental health.
Gambling and other disorders, personality.
Yes.
Yeah.
So you're right. Gambling can also occur because this is the drugs and alcohol and gambling, what you're saying. It gives you people a false sense of fulfillment, that they have achieved something and they want to crave for that short-term happiness, but they lose the bigger picture that long-term it's damaging to their personal life, physical, psychologicals. And I've seen so much, and I was talking about family violence, and they all emerge from when people end up using these drugs, alcohol, gambling, lose money, then you need to have more money, then you end up having this family violence type situation. So it is very tricky. So that was a very good question you asked. Thank you.
Which means, Dr. Moudgil, the persons or patients who encounter these kinds of symptoms, so they don't try to shake it off or they don't try to bottle up things themselves, they should see get professional help, like seeing a GP, psychologist, and then get referred to a psychiatrist, as that's our system in Australia works. Is that what you suggest? Yes.
Yeah.
That's good. You see, Dr. Vikas, most specialists and psychiatrists, tend to have a special area of interest. What is your area of interest in your field of psychiatry? Please let us know.
Yeah, I'm a general psychiatrist. Means I can look after any illnesses which general illnesses, anxiety, depression, and anxiety also doing with panic attacks, phobias, post-traumatic stress disorder, plus in terms of depression, bipolar illness, schizophrenia, drugs. So I look after that. I also have got experience of treating old age people, although I don't specialize in old age psychiatry. That's a different psychiatry. Child and adolescent
dementia and others?
Yes.
Yeah, okay.
So child and adolescent psychiatrist, I'm not specialized in that, but I can see the common problems which affect that, although I could be referring them to specialists. But I've got, as a general psychiatrist, overall knowledge base of predominant all the mental health issues, but I work predominantly in general adult. That's my work of experience.
Sounds good. I think Abba will have something out of
talking
you.
about all these serious issues which are very significant to us as people and as a community. Let's talk about your hobbies. What hobbies do you have? What sort of activities do you like doing apart from work?
Look, that's a very good question. Not in terms of that what hobbies I've got, that people do need to have some kind of personal hobbies to survive this. I would say psychiatry and any medical line is very tough, because how do you switch off when you are seeing all those difficult times that people are experiencing? It does brush up on you also.
Yes.
So in terms of trying to have a break from the work, when you come back home, you sort of have to have some discussion about how the day was with your partner. Plus, in terms of you have to have good sleep and good appetite, and not good appetite, but eat something healthy, because that's what I've realized, that you need to look after yourself. In terms of me, I focus much more on eating healthy and looking after myself. In terms of hobbies, my new hobby has been the golf for the last 3 years, which I don't manage to sort of find so much time, but once a week, if I can get a time, I'm very happy with that. Other is watching television here and there, but I don't get to watch television that much. Yeah.
Not much time for you.
Not much time. Also, it just disrupts my peace of mind, because if I see something very, brutal and blood and gore, and then you end up not sleeping well. So what's the point? So I don't like sort of watching television that much, but I do find some television series very interesting. But that's my hobbies in a nutshell. I do looking at my physical health also. Make sure that I exercise and regularly. Yeah.
That's really good. That work-life balance is so important, which we all struggle with, we all strive for.
Yes. It is not easy.
It's not easy.
Yeah.
Dr. Moudgil, if there was one health message for our viewers, what would you give as a health message to our viewers?
You mean like a final take-home message for health and well-being, both mental and physical?
Yeah, that's a very good question, because where I see things from 4 categories if you have to look after your own self. One is your personal well-being. Second is your interpersonal well-being in terms of how you interact and look after your family and friends. Third is your social well-being, where you need to look after yourself in social outings and have time to yourself as a relax, not work-related, but social life. And last is the occupational life, where you do need to look after your own career, your profile, how that is going, because if stress could be affecting you, you need to look after these 4 categories. In terms of your personal life, I do recommend people to focus time on your own self. That may mean exercise, good sleep, exercise, and meditation. People some find yoga. People find it helpful. Whatever helps. Look, one size doesn't fit all. Look, I can't do yoga, but meditation I struggle, but I just managed to go for a walk or something that helps. So whatever helps you, do it. But you need to find time to your own self. And look after your physical health. Don't ignore if you're having some palpitations, maybe that hypertension. You need to go to GP and get yourself checked. You cannot ignore. Mental health is not just focus on mentally thinking, but it's about your physical health also. And I do take good diet and exercise, plus You need to look into your social life, which I explained that you need to have some friends which you can associate with. Not just going out to have drinks and alcohol with them all the time, because that just misses the point. Because you need to have good social and like-minded people who can have guts to tell you that you are looking tired, you need to take a break. You don't need people around you who are just going to agree to what you are doing, you're good, you're good, you're good. No, you need people who can confront you to say, look mate, you're not doing good. Okay, you need people like this. Interpersonal, I would love to have people devote more time to the family. If there is family stress which bugs you, you won't be able to perform anyway. Okay, so you might get distracted. So love your family, give a time to them, and if there are any issues, talk about that. I think men have tendency not to talk about that. Talk about it, even if it means, your ego is hurt. You are in learning phase. Each day is a learning. You need to learn more about it. And occupational life, I think, lastly, I would say, look after your career. And if there's stress at work, address it. Talk to your boss or talk to your colleagues that it is affecting me. Because it's not mental health is not about just absence of illness, it's looking after your overall personal, interpersonal, social, and occupational. And if people find some religious and spiritual thinking also, that's your personal well-being. Go for it.
That's a good take-home message. Don't you think so, Abba?
Yes, it has been an excellent talk, very informative. We've really enjoyed talking to you. Thank you for coming on our program.
Thank you very much for the invite.
And in the name of the Indian Medical Association of Queensland Doctors, we thank you very much, Dr. Vikas Moudgil.
I do appreciate it. Yeah.
Thank you.
Thank you.
Thank you very much, Dr. Cyril Fernandez and Dr. Eva for conducting that interview. And very, very informative. I think, some of the take-home messages there are very, very well looking after your health, looking after your mental health as well, staying fit, eating well, and all of those. So this has been a special presentation of Indian Medical Association of Queensland, brought to you together with Dr. Cyril Fernandez and Australian Indian Radio. Until next one, it is goodbye from us.